Hello, good morning.
Morning.
Hi, Sagar.
Hello, all well?
Yes, thank you. You?
I've been busy. Lots of stuff to do.
Oh.
Dr. Sharma.
Hi Jackie. Hi, Shaker.
Hi, Dr.
Hi, Isha.
I think,
Oh, Rajesh has joined as well. Hi, Rajesh.
hello, sir.
And Sabahat as well.
Yeah.
Oh, it's lovely to see everybody. Anyway, I'm going to mute myself. Otherwise, this webinar might go on till, well, let's not even say.
No, I think Isha has been managing splendidly.
Hi, everyone.
Hi, Sagar. How are you?
I'm good. How are you?
Thank you. Rajesh Sagar has also joined us now. Hello, sir. Are you able to
Hello, good afternoon. And yes, you can hear me,
Yes,
Isha?
very well,
Okay,
sir.
great, wonderful.
Very clearly, Rajesh. Quite clear.
Very namaskar, and good afternoon, boss. Now you can see us.
Okay. A very good afternoon to everyone in this part of the world. A good morning to everyone joining us from the UK and perhaps even other parts of the world. It is, as usual, an honor and a privilege to welcome you all to this webinar series once again. We are at the third session of the series that's called Mental Health and the Second Wave. This is brought to you by NEESAMA, supported by Samvad. As usual, a brief overview of the housekeeping rules. We are beginning and will end on time, so please make sure you're locked in throughout. You have been muted by host upon entry. That's just to maintain the session decorum. If you're invited to speak, if you'd like to ask a question, if you have time to actually go into live questions, you will be unmuted. Please do start putting in your questions in the chat box meanwhile, because a lot of questions that come in tend to be related, the same area. So I'd like to club them and present them for the benefit of both the audience and the panelists. Lastly, it'd be wonderful if we can have a lot of videos on. It's nice to chat, to have these meetings, seeing a lot of faces, but of course that's the only not mandatory rule. So please feel at ease, and depending on your network connectivity, to keep your video on or off. Well, before we get into the session, and I can see that people are still joining us as we're starting, let me introduce you to the expert panelists joining us today. Professor Rajesh Sagar is Professor of Psychiatry at the All India Institute of Mental Health. I'm sorry about that, at the All India Institute of Medical Sciences, that is AIIMS in New Delhi. He comes with rich experience in clinical and academic psychiatry. He has published on various aspects of mental health and COVID-19, including talking about systemic reforms, the concept of mental hygiene alongside hand hygiene, also the impact on children and adolescents. In this session, we will have Dr. Rajesh Sagar directly. We also have with us today. Sorry about the disturbance. We also have with us today Dr. Sabahat Haqqani, who is Head of Department Psychology at the Capital University of Science and Technology, Islamabad, Pakistan. Dr. Sabahat is a practicing clinical psychologist. She has been working on programs for anxiety and stress management and life skills in young people. She will be sharing with us her experiences of individually assisting people in the context of the current pandemic. And the third panelist, Dr. Jackie Rogers, is Chair of Psychology, Mental Health, and an autism researcher based in the Faculty of Medical Sciences, Newcastle University, United Kingdom. Dr. Jackie has specific interest in the concept of uncertainty and how we respond to it and cope with it, which is, of course, a key issue in the COVID-19 pandemic context. So in this session, we will be learning from Dr. Jackie's unique expertise in this very niche area. So as you all know, today's session is going to be about living with the pandemic, coping with the pandemic, not panicking. So the session is aptly titled, Do Not Panic, instead respond to the COVID-19 pandemic at both home and outside. Now, if you will recall, pull the slides more. As you will recall from the last session, we were talking about how the mental health impact of this pandemic is actually going to be the most long-lasting wave. So after the immediate morbidity, after the mortality, after the interruption of clinical care for other chronic conditions, what we're going to be left with is, the fourth wave, which is essentially going to be about mental health. Next slide. And sadly so, the majority, the large proportion of this mental health impact is going to be borne by young people, by 15 to 34-year-olds, by the millennials. So that's where we're seeing the highest proportion of anxiety and other mental health impact as a result of this pandemic. Next. So I came across this book, and I'm sure a lot of you have also had a chance to, you may have had a chance to look at this. So it's called The Psychology of Pandemics, and it's by Dr. Stephen Taylor, who is a professor of psychology at the University of British Columbia in Vancouver, Canada. I was listening to one of his webinars delivered earlier this year, where he talks about, next slide, where very interestingly, he has contrasted past pandemics with the current pandemic. And while there are two long lists on the screens in front of you, but the thing that I want to bring to your notice here is that while the differences are very systemic, they're about interconnectedness, they're about global, digital coverage, social media. So those are the differences, but look at the similarities. The similarities are essentially about the behavioral response of human beings to catastrophes like the COVID-19 pandemic. So right from anticipatory anxiety, xenophobia, a very conflicting relationship with healthcare, altruism, conspiracy theories. Who hasn't heard about that in the COVID-19 context? Even mask rebellion, vaccination refusal, vaccination hesitancy. So essentially, there is there seems to be a behavioral pattern that emerges after pandemics or after such disasters that impact so many of us all over the world. Next. And along with that, so as we are going through the uncertainty, the illness and death that comes in, that the pandemic brings in, of course, the socioeconomic costs, what is increasingly being realized is a very specific entity called the COVID stress syndrome. And of course, who gets affected by the COVID stress syndrome? It is people who have other vulnerabilities, as we understand for, all of mental health. So when you have more vulnerabilities, you're more likely to develop even the COVID stress syndrome. Interestingly, I'd just like to point you to a vulnerability, which is the fourth bullet point, that is OC features. So, in your personality, if there is anancasm, there is a tendency to obsess, to have obsessive compulsive experiences, then that also seems to predispose you to developing the COVID stress syndrome. This is especially relevant because the next session is going to be about OCD in the COVID-19 pandemic. So I just thought I will highlight that here. Next. And so, so we know that all of this mental health impact is happening as a direct result of the COVID-19 illness and the pandemic. And then, of course, are all of the issues to do with the lockdowns, the constant experience of frustrated non-reward. Every time we seem to make plans, which get thrown right back on our faces because there's a second wave and a third wave, the increasing distress, lockdown fatigue. I mean, everyone's tired of staying at home and not being able to go out. And what is post-pandemic? Is there going to be a post-pandemic life, first of all? And if yes, what's that going to be like? Will there be long-term sequelae, especially for us from mental health? Are there going to be psychiatric, psychological sequelae? Pseudo-agoraphobia, a lot of frugality coming in, which seemed to have been the pattern from previous pandemics, germaphobe. So Stephen Taylor, what I found interesting is that he's doing this, really contrasting past pandemics with the current scenario that we find ourselves in. So, and these are also issues that are very pertinent to the discussion that we will be having today, and which of course is about, coping during the COVID-19 pandemic, not panicking, but responding to it in a manner that is adaptive. With this, I let's get into the panel discussion. To begin with, if I can request Dr. Rajesh Sagar first to respond to the theme of the session and also share with us his thoughts and experiences from his mental health practice in the pandemic. So over to you.
Good afternoon, Isha. Thank you so much. Can I share my slides, or you think that I can?
You can share your slides, sir.
Okay, great. Wonderful. So, just a minute, I will just share my slides. Sorry about this. I think there is some problem. Just a minute. Okay. Okay, thank you so much. I think wonderful. My thanks to NEESAMA, Samvad, Nimhans, Dr. Shekhar Shadri, and Isha, and my co-panelist, Jackie and Sabahat. I think that's a wonderful panel for from 3 different countries, and was looking forward to it, and I think that's a great title, Do Not Panic, I think, which is, sounding very positive in these times of COVID. I will quickly go through because I know that time is very short, so maybe 5 minutes were allotted. I will just select a few points which are there, and maybe I will come back for discussion. We all know, I think we have been discussing this point that COVID is something which is not affecting the mental health problems are for COVID positive, but we need to also understand that it's affecting general population, people who are in isolation or quarantine. Whole lot of literature is there, and family members of patients, especially those who have died, and in that way. So the point is that it's not only COVID-19 patient, but mental health issues are much beyond that, and that is why people are calling it as a parallel pandemic, or pandemic in pandemic, or mental health. I completely agree with Isha. The 4th wave, the mental health issues are going to be at the forefront. I will just some of these important publications which we have. I just selected few which we have done brief publication. One of the one which we did last year, which caught attention of media also, preserving the human touch in times of COVID-19. I think we need to understand that everyone around us with a mask, with the PPE. Just imagine that any patient who is there in the ward, what the situation would be, gadgets around or people. So just imagine the plight during that time. So I think that was just briefly we wrote that how we can preserve the human touch considering all the difficulties, and that is how I'm not sure whether you are aware of it. At AIMS, we had those who were admitted to allow the video consultation, like they can talk to family. It was just to how we can preserve the human touch in that way, and the communication through PPE and some of the bedside etiquettes and so on. The other, I think, which Isha talked about, the mental hygiene. That's we thought it's a very important concept. We are talking of hand hygiene all the time, but mental hygiene becomes so important. You see the whole concept of mental hygiene, the way it was revisited, it fits well in these COVID times, like mental hygiene defined as a promotion and preservation of the condition, which adjusts itself efficiently and continuously to changing environment, and all those points which are so important, how the healthy environment should be, adaptive behavior and so on, healthy defense mechanism. So it perfectly fits with the concept what we are talking of, the same way we are so much stressing on the hand hygiene and other part, but similarly the mental hygiene. In fact, that is what we recommended in Arogya Setu. There should be a questionnaire about mental health also, so that everyone is self-aware about their own mental health, along with the physical health. Then this is what we wrote also, the intersectoral activities at the times of COVID-19. I think we all know that how important it is. This COVID pandemic actually has taught us that how we need to coordinate the activities and the kind of efforts which have been made all over the world, including India. We know that has been tremendous, and we all know about the horizontal synchronization and vertical synchronization. Vertical is the one which is a top-down approach, where we with the same, whereas horizontal it goes with different departments, like taking care of shelter, taking care of food and other aspects. So I think that's this intersectoral coordination has been tremendous. I think that's what we need to be aware of. The other we wrote, we invited as a Lancet Psychiatry that COVID-19 offering an opportunity to reform mental health in India. I think this is very important, especially the momentum which is there, and we have urged that how the mental health activities which have been initiated, they should continue, and this is a unique opportunity in that way, that how we can reduce the treatment gap and this additional burden which has been there, and to see that in the future how we are going to handle this. And we also need to see it's a beyond healthcare. I think in the way that how we can involve education sector, workplaces, social welfare, gender empowerment, child and youth services, criminal justice and development. So this is what we have wrote, in this Lancet Psychiatry. Just a brief, just to have an emphasis on continuation of the mental health reforms with regard to COVID-19 efforts. I think with this, I will end here. I think just to start with, just wanted to raise some of the important points, and maybe we can specific questions after listening to the panelists, we can respond to specific questions which are there. Thank you, Isha. Back to you.
Thank you so much, sir, for keeping it so brief and pertinent. So you have spoken about, so of course, in responding, things like the human touch, mental hygiene, very important concepts, and certainly we're going to come back to them. Let me now request Sabahat.
Yes, Isha.
5 minutes.
Yeah, I'm here.
Please go ahead.
Okay, I'm going to share my screen first, then I'll start talking. Okay, I believe everybody can see the screen. So first of all, hi to everyone. I would really like to appreciate this opportunity to communicate with you all. As you all know, it's been almost 1.5 years since we have been dealing with this COVID-19 pandemic, and I believe it has brought multiple other related issues that have completely uprooted our routines. And routine is the key word here, as I believe this can act as a crucial factor in helping us cope with our current situations and formulate strategies for future. Usually when I take part in such talks, I take a very educative stance, and that's of course because I'm an academician. However, I would like to start with sharing some of my observations from my clinical practices. I have been attending to clients who would complain a lot about, sorry, I need to change the slide first. Probably I'm.
Sabahat, I think, yeah, the slide's not moving. Yeah.
Yeah, sorry, I don't usually work on Zooms. That's why I needed some time to figure out how it works. So I was saying that I would like to share first some of my observations with respect to my clinical experience. I have quite a lot of clients who would complain of symptoms like anxiety, stress, irritability. They would talk about things like lack of energy, there's lack of routine, blurring of boundaries, restlessness, and having multiple tasks at one time. And I must admit here that I have experienced some of these symptoms as well. One interesting thing that I have noticed is that the total number of tasks that we used to do on daily basis has not increased. It's the same amount of work. The only thing is that all of this is crammed into a single time point. For example, if I used to teach and communicate in the mornings and then perform other chores in the later in the day, I am doing all of this simultaneously for the whole day because of the change in working situation. Now, an individual can hold only so much of the cognition in a single time point, so much of thoughts in a single time point, and the space we use for this holding all of these thoughts in a single time point is called mental space. So the mental space we have is now completely occupied due to the change routine or the lack of routine we have, which means that the mental load has actually increased to an extent where it has occupied all of our mental space. And one thing I must also point out here is that there's a gender imbalance in that. Do you know that the pandemic has actually magnified the gender differences both in terms of the childcare arrangements we have within the household and at work? Women have carried heavier loads than men. They have to simultaneously manage their work responsibilities, their house chores. They have to take care of their childcare responsibilities. They also have to regulate their online education because quite a lot of online education providers rely on either a mentor or a parent to implement whatever activities they are communicating through online system. The reason I'm mentioning this is because I believe we must acknowledge this before we move on to thinking about how we can handle these specific concerns with respect to responding to changes brought about by COVID-19. I must also add here that many of us also are facing the issue of relocating to our office spaces, back to our office spaces after working from home for such a long time. There are two specific situations that I would like to highlight here. One is with respect to student screen time, and other is with respect to parents' struggle to manage screen time for their children, especially this is for children who are enrolled in elementary to middle school years. Now, there is a very interesting concept we use in our daily lives, and this is related to these two concerns. Now, this is called self-regulation. If I define self-regulation in a typical academic context, it's a theoretical context. Now, this is self-regulation is defined as the extent to which people influence, modify, control their own behavior, including their thoughts and feelings, according to the goals or the standards they have. Now, I know that the goals we have are same. We still want to gain knowledge and educate our children in the most efficient manner possible. We also know that the shift to online system has actually increased our screen time for all of us. And coping with all of that has taken its toll, which has affected our emotional states. One strategy that we have been using to manage our emotions even prior to COVID-19 is self-regulation. We usually depend, and for the self-regulation, we usually depend a lot on our external resources. And this is especially true for collectivist culture. For example, we ask our friends and family to give us a reminder where we can actually set up all of those reminders on our mobile phones. Now, keeping the context of COVID-19 in mind, we can see that all of this has to be done based upon our internal resources, which proves to be really hard for us because we already have a fully occupied mental space and we have to simultaneously schedule or follow up on our own tasks, as well as we have to bear the responsibility of scheduling the tasks of other members in the household. There is no easy solution to this. However, there are techniques that we can use to find balance, and one such technique is self-regulation. The question is how do we implement self-regulation? Self-regulation is not just about cognitions. It is also about our physical activity, our social and emotional aspects. So one of the techniques we can use for implementing self-regulation is to introduce breaks in our online activities. For example, going for 5 minutes walk around the house or the garden. Ideally, it should be after 1 hour, but we can also do it after it must be done at least after 3 hours of screen use. Another technique can be prioritizing tasks in order to let go of the ones that can be scheduled at a later time. In theory, this makes sense that we can prioritize tasks, but we need to train ourselves to recognize that there should be an order of priority to the task that we want to perform in a given day. Now, last technique that I want to share with you is, it's not really a technique, it's something that we experienced in Pakistan, that we did not really go to as stringent lockdowns as other countries did. We instead ended up isolating ourselves into smaller groups, which gave us a huge advantage in terms of managing our emotional and social side of self-regulation. So isolating into smaller groups could be one of the techniques we can use, especially with reference to the developing countries where there is a huge balance that we have to maintain with reference to implementing strategies for managing COVID-19 and meeting our socioeconomic needs. So these are the three things that I believe could be useful for people in order to manage their routines and stress in times of COVID-19. I would like to acknowledge that all of these techniques of self-regulation will not work for everyone, as I understand that pandemic has taken a great personal toll in the form of human life and loved ones in our respective communities. And this has increased the burden on individuals in their respective household. I acknowledge that loss and suggest that with time, we can train ourselves to recognize our limitations. And it is imperative with time that we learn to do this, to get used to this very new and uncertain normal. Thank you very much.
Thank you, Sabahat, for raising those very specific issues and also, already leading the audience into some of the ways of responding to the current situation. I'm especially intrigued by the concept of isolating in smaller groups, and perhaps that is something we'll come back to you later on in the session. Dr. Jackie, could I come to you now?
Thank you. Yes, good afternoon, good morning, depending upon what place in the world you are. I'm going to share my screen now. Hopefully you can all see that. Okay, well, first of all, thank you to Isha and Rajesh and Sabahat for their really interesting points so far in this webinar. It's really, really interesting to hear things from their perspective. So I'm going to focus a bit today, as Isha mentioned at the beginning, on this idea of uncertainty. And it's something that I've been interested in as a kind of research field for quite some time now, but feels particularly relevant and pertinent to the COVID-19 pandemic and the situation that we all find ourselves in, regardless of where we are in the world. Of course, things are continuing to change for all of us. We're in lockdown, we're out of lockdown, we have restrictions, new variants are emerging, and things are continuing to be uncertain and to change on a daily, sometimes hourly basis, it feels. And often we have very little time to plan and to prepare for those changes. So children are sent home from school, people are asked to go into work and then to work from home, etc. And coupled with this, we will all have experienced worries and anxieties about the COVID-19 situation, what impact it's going to have on us, on our employment, on our loved ones, on society, on the future, on our children's future. And we've been living with this situation now for getting on for 18 months. And so those increased worries and anxieties and stresses are becoming somewhat chronic, unfortunately. And of course, as I said, life remains very, very uncertain. Now, we've known for quite some time now that difficulties with uncertainty can impact on an individual's mental health. So this idea of thinking about uncertainty as a mental health construct emerged in the 1980s when Michel Dugas and colleagues developed a model of generalized anxiety disorder for adults, which was underpinned by a process variable that they labeled intolerance of uncertainty. And what they referred to there was the notion that individuals who have high levels of this dispositional construct, this intolerance of uncertainty, will perceive information in uncertain or ambiguous situations as very stressful, upsetting, and threatening. And that uncertain events are negative and to be avoided at all costs. And you can see there on the screen the original Dugas model of generalized anxiety disorder, where you can see pathological worries kind of swimming in this soup of intolerance of uncertainty. And since the early work of Dugas and others, intolerance of uncertainty has kind of moved out of just being a construct associated with generalized anxiety disorder and is now seen as a really important transdiagnostic construct impacting and influencing a range of mental health conditions, from anxiety through eating disorders, depression, substance use, OCD, psychosis, and suicidality. So what we see really is a kind of a perfect storm within the COVID-19 pandemic of chronic and really impactful uncertainty across many, many areas of our lives, impacting on mental health for a range of different individuals who may have a kind of a vulnerability to different types of mental health conditions. So it's not surprising then that we're seeing a kind of real upsweep in mental health conditions as a consequence of the COVID-19 pandemic and possibly as a consequence of this kind of pervasive and chronic uncertainty that we're all experiencing. In addition, of course, if we focus down on health anxiety, there's now quite a substantive body of literature suggesting that intolerance of uncertainty contributes to the development and maintenance of health anxiety. And particularly if we think about safety-seeking behaviours, such as the search for health-related information, these can serve to reinforce health anxiety by leading to this belief that uncertainty about health can't be tolerated. And this results in a self-perpetuating cycle of health anxiety symptoms. And of course, in the context of COVID-19, where there's a huge amount of social media and kind of publicity around the pandemic, it's really difficult to actually avoid informational content around the pandemic, and that may serve to reinforce these safety-seeking behaviours by people experiencing health anxiety regularly engaging. The other thing I wanted to draw your attention to today is whether the uncertainty associated with COVID-19 may be a particular issue for our young people and for their futures. We know from quite a body of research now that the relationships between intolerance of uncertainty and anxiety and maladaptive coping strategies peak during adolescence. And adolescence also involves significant neural changes to the saliency network in the brain. And experiencing high levels of intolerance of uncertainty during adolescence has been demonstrated to lead to a disruption in the development of this salience network and its connectivity to other canonical networks. And so our adolescents, our young people, may be particularly vulnerable to the uncertainty related to the COVID-19 pandemic. And it's going to be really important for us to bear this in mind and to keep a careful eye on young people as they develop and grow, and hopefully, beyond the current situation. And in actuality, a recent study from our group led by Adi Sharma demonstrated this in the context of COVID-19. So this was a large-scale survey of health, anxiety, and coping mechanisms in an Indian community sample in the first week of lockdown. And our data suggested that actually young people did experience more health-related anxiety at that time. And they were also more likely to engage in social media as a coping mechanism. But bear in mind what I said about kind of safety behaviors and seeking informational content, much of which was contradictory or actually false. Our conclusion in this paper, however, is that mindfulness-based strategies may actually help to reduce health anxiety by increasing tolerance to the uncertainty that we're all experiencing. So let's just think a little bit about how we might be able to help people experiencing intolerance of uncertainty related to the pandemic. Well, psychoeducation around the uncertainty cycle might be really important. People often don't talk about the impact of uncertainty on their lives. It's something that we're not maybe consciously aware of. So having those active conversations with one another might be helpful and help to develop a formulation around the impact of uncertainty. And also spending some time identifying strategies that may not be helpful, such as over-preparation or information seeking safety behaviors that actually may reinforce beliefs about the scariness of the current situation. And for individuals who need a little bit more help to tolerate the uncertainty of the pandemic, then there is now emerging evidence that CBT-based techniques to increase tolerance to uncertain situations can be helpful, as can mindfulness-based CBT and ACT therapy to help someone to sit with and be able to cope with the uncertainty that they're experiencing. Thank you very much for your attention.
Thank you, Dr. Jackie, for perhaps covering the most key construct that we're all having difficulty dealing with in the pandemic. If I can stay with you, because there's also been a question about uncertainty, and if I can get that to you. So this is a question from Dr. N.D. Sanjay Kumar, who says, my question regarding uncertainty, not specifically in regard to the COVID-19, but in general, how do we, so you refer to some of them, but how do we cope with that uncertainty, specific strategies, if you can talk about that? What is so fearful, or why are humans so afraid of uncertainty? Is this something that's actually, that even other, he's actually asked, are there other animals also that deal with similar issues? But maybe there is something to learn there as well. So his question is basically about how do you identify the intolerance of uncertainty, the impact of it on you, and specific strategies in terms of dealing with it.
Thank you. So that's a lot of questions. So in terms of identifying intolerance of uncertainty, often it's something that isn't, from my experience of working mainly with autistic people and autistic children who experience high levels of intolerance of uncertainty, often it's something that we're not consciously aware of. When we react to a situation and we feel anxious in that situation, the fact that there's uncertainty in that situation is not necessarily something we immediately assume or immediately kind of leap to and say, oh, it's the uncertainty about that that's making me anxious. And so one of the things that we do spend a lot of time doing when we're working with people experiencing anxiety is actually very directly asking them to kind of tease apart the contributing factors to an anxiety-provoking situation and actually identify whether there is something uncertain about that situation. And then if there is, try to build a formulation that's based on uncertainty. So what is it about that uncertainty that's anxiety provoking? Is it because it makes life unpredictable? Is it because it makes you feel unsafe? So really drawing someone's attention to the contribution that uncertainty can have to their daily lives can be a really powerful tool to begin to have those conversations. Once that's actually been identified, if it is an issue for an individual, then the next step is to think about how to be able to cope with that uncertainty a little bit better. And it's interesting, when we talk to parents about the uncertainty-related anxiety their children sometimes experience, mums and dads often tell us that the sorts of strategies that they typically use would be to try and reduce the uncertainty for their child. So they try and make the world really predictable. They have lots of routines, lots of schedules. They don't take their children to unfamiliar places if uncertainty is an issue. And of course, reducing the uncertainty in your environment can be a helpful thing, but it's not something that will apply in all contexts. There are situations like COVID-19 where, as much as we want to, we can't reduce the uncertainty. Things are inherently uncertain. So one of the strategies that we try to develop in our work and in our interventions is to help someone to be able to tolerate uncertainty more in a more kind of effective and successful way. And things like using mindfulness-based strategies to be able to sit with the discomfort that uncertainty often brings with it. So you can get physiological responses to feeling uncertain. It feels icky, it feels uncomfortable, it makes you feel physically anxious. So being able to sit with and tolerate those experiences can actually be really, really helpful. And then being able to tolerate the not knowing, the cognitive aspect of it, and being able to accept that things can't, always be absolutely predictable. So I guess key thing is to draw people's attention to the impact that uncertainty is having, and then begin to work with them in whatever context is appropriate for them to help them to be able to tolerate uncertainty a bit more, rather than always relying on reducing the uncertainty, because we can't always do that.
Thank you. Dr. Rajesh Sagar, if I can take the next question to you. Dr. Arnab Bhattacharya has asked this question, and he asks, can we learn anything from past pandemics? Because you have written about systemic reforms and how this is a time for mental health to kind of, take stock of the situation and respond. So Dr. Bhattacharya says, can we learn anything from the study of the 1918 pandemic and implement it to the better management of the mental health aspects of the current COVID crisis?
That's a very important point. I think we all need to know that any crisis gives us the opportunity also. I think we need to understand that. And not only 1918 pandemic, but even a lot of evidence-based research is there after the SARS and MERS episode, which happened a few years back, and many such aspects are being documented with regard to what needs to be done. I think what we have to say that in that regard, what IASC, that is Interagency Standing Committee, that's a beautiful pyramid which has been shown. The most important aspect in any pandemic, what we have to learn, and which we are learning in this pandemic also, is the kind of community support, the community mobilization, the community efforts. Actually, if you see that pyramid, in fact, I do not have a slide usually. I do talk about it. The health services are at the top, which are very minuscule. The major component is the community support, I think, and that is what we need to learn. Even we have been discussing in this pandemic also that the kind of material which has been made, the kind of education material, the kind of mobilization which has taken place is tremendous all over the world. In India also, the IEC material, the video films, the efforts which are being made at different levels have been tremendous, I think, and that has given the opportunity that what we can do and how we can learn. So of course, the point is that every crisis situation or challenging situation gives us the opportunity and how we can learn. And the previous pandemic also, we know that there was something to learn. In fact, even in the previous SARS and MERS, a lot of mental health symptoms are being reported. In fact, some of the literature which is there in the previous, what is there now, same, some of those psychiatric symptoms and disorders are being reported in the form of anxiety, depression, stress-related, PTSD, even sleep problems, all have been reported in the previous pandemics also. Now, what is important is that how we can prepare ourselves. I think what you are emphasizing, Isha, is very right, that health system reforms, I think that is what is needed. And we need to prepare ourselves, because we all need to know that our health services are not geared towards handling the pandemic like situation actually. And we all know the kind of services which were required, like number of beds which are needed, the oxygen supply in our country, so it came such a big number in that way. So so we are not geared towards that. So similarly, mental health aspects also, because the services, the professionals, we already know that they are much less, because always since working in the epidemiology area, I know that we have a huge treatment gap, I would say in the range of 80 to 90%. That's a big. Now just imagine that the country, that low and middle income country, that such a huge treatment gap is there, and to have such pandemic like situation, then you can imagine. So the important thing is that even in this pandemic, something which was very important, which really changed the game, was that the home-based management. We all know that 90%, 80% were people were treated at home. It was like community-based management, which actually was very important. If let's imagine that all who had come to hospital, and what would have happened. Similarly, what is important from mental health aspect also, what is important, most of those training program which were there, and so how they can be managed at their home itself, in their community itself. And that is why the importance of things like psychological first aid, how we can look, listen, and link people, how the services can be provided. Only minimum actually requires a hospitalization. So and this is true for mental health also. So that's what I think we need to know, that how we need to prepare ourselves for the future. And that is why a lot of talk is there, that what we need to do for subsequent wave which happens. And similarly, we need to gear ourselves up for the mental health issues also. And this is the time now we need to prepare. And not everything will be at the hospital. We need to see that how we can train other people, like say for we need to train our medical doctors or paramedicals, and all the efforts are being started. And major institutes in the country are doing that work, that how we are training other people. So in a way, that would be very helpful. Not relying completely on the specialist, I think that will be the key to manage any crisis. And that is what we have learned. And this is something to learn for the future also. Back to you, Isha.
Thank you, sir. So I think if the audience will recall, this also reiterates issues that have come up in previous sessions, where we have, touched upon the examples from Nepal about community mobilization, training local people, to deliver home-based care services, and where Dr. Rajesh Sagar quite nicely points out, it's about looking, listening, and linking. And I think that is, the key to a successful community engagement program. Let me take the next question to Sabahat. That is actually specifically addressed to you. Ashish Agarwal asks, usually when we talk about trauma as a term, we refer to situations like partition, the World War, and other things in mind. And these are what come to the fore. Can you explain a bit about the trauma that is caused in the context of the pandemic? does the current situation actually fall into the ambit of the term trauma? Sabahat, could you catch my question? Can you check it, please?
Isha, can you hear me?
Yes, yes, we can hear you.
Okay, so I think that with respect to pandemic, it is a lot about the emotional trauma. It's which affects, yes, mental health, and it can flow into your physical health as well. With respect to that, if usually when I talk about this, I have a very preventive stance on this, where I trauma, as Dr. Rajesh has pointed out, I think a step, if required, psychological first aid could be a very useful technique that should be that could be implemented, and this could be one of the low impact strategies that we can focus in terms of transferring skill to the community. But in terms of preventing it, whether it's a situation related to pandemic or some other situation, what makes a huge difference is the fact that we rely a lot on our coping skills. So developing, and some of the coping skills would work in new situations, some we have to learn with respect to the new situation. So as I said earlier, that we're still experimenting with what we're doing in terms of the medical science we're applying, and in terms of mental health and the way we are coping with the situation. I believe that we need to recognize that this is as a first step that there is emotional trauma, and there are its manifestation, and this is definitely coupled with the loss of loved ones we have, and change in the family structures, and also because of the responsibilities that have been increased due to COVID-19, directly or indirectly. So the first step is that we recognize it. Second step is that we start formulating strategies for that. And I think someone else also wrote that in the chat, that they would want me to talk more about isolation. I think this is where isolation also comes into play. Isolating, when we think about isolating, the first image that comes to mind is that we're isolating ourselves from everybody. Whereas if I look at specifically from the context of Pakistan, what has happened as a ground reality is that people have isolated themselves into smaller groups. It's like a social bubble where you know that these are the people I would be interacting with, and these are the people with whom it is inevitable to interact. I can't really avoid it. So that could be one of the protective strategies to deal or protect yourself from trauma.
Sabahat, if you could expand a bit more on that. So when you say that, you identify, and when you identify people who I have to interact with on a day-to-day basis, so then how does that operationally play out?
Okay, so if I think about, let me give you an example from my personal life. For example, if I'm working, and then that means and most of the working women who have families, they would need childcare as well. So you have to establish those small social bubbles where you know where the child would be if you're working. That means you actually make a note of the people who you would need to function. For example, I might have some relative or some other caretaker, and I would also, it's much easier to calculate that actually in case of a relative, because then you know it's going to be them and you. But in case of the caretaker, you can still make a calculation how much is the interaction going on. It's not, in a developing country, it's not possible for people to completely socially isolate themselves, because our health needs are competing with our economic needs. So that's why I was saying that recognizing and identifying with the people with whom it is inevitable for you to meet, and then forming your social circle based and limiting your social circle to those could help people balance between their health needs and the economic needs. As well as I think it has an added advantage of addressing your emotional needs as well, because you wouldn't really completely go into physically isolating yourself.
Right. Yeah, thank you for that. Dr. Aditya Sharma, would you like to add something to this?
Yeah, thanks, Isha. It's lovely to see Rajesh, Sabahat, and of course, Jackie. Just wanted to say, in addition, that's such a lovely question that is asking for what might be the difference between, something that was quite devastating for the Indian subcontinent, the partition, or other calamities that have occurred. I suppose for me, one of the biggest differences, and this is more from a personal note, one of the biggest challenges has been that in all of these other calamities, you can interact socially and go through the process of grief. You can seek out social contact. Not all of it is possible, but even with strangers, you can hug them, you can seek them out, whereas the pandemic does not allow us to do that. We are, as human beings, one of the most social animals, and a calamity that prevents us from seeking out what is so fundamentally basic and defines us as humans, I think is the biggest difference. So that's all I wanted to add to what Sabahat has just said, because we're being prevented from grieving, mourning together. It's the world over. I think what unifies us is funerals in the UK, births, marriages, deaths. There's no shared grief or celebration, and I think that really has caught us unawares and unprepared.
Thank you very much for that. Dr. Rajesh, Sagar, we did talk about, the entire issue of children and adolescents and, parenting, how that becomes a big challenge. So Malika has put up a question, which is regarding the dilemma between reducing screen time and still letting preschool and primary school children have that time with peers or other social connections during these testing times of social distancing. Having half a day in front of devices for school, then an hour of gaming is already too much time spent in front of the screen. Then they long to get in touch with their peers, even if trying to engage in other ways, they're missing the connection. So monitoring screen time, I think, is perhaps the biggest challenge for parents. Your response?
Yes, I think, I think that's a very, very important point. I think what the question is, and what we need to know that during this pandemic, what has happened is the screen time has increased. Now, what is important, sometimes, in our clinic, I'm sure in other clinic also, a lot of parents are coming to us and they are concerned about that my child is spending so much time in the screen and so on. The point is that always I say you have to give the opportunities, you have to give the alternatives. Now what has happened that those alternatives are not there now, because a child, just imagine the situation, a child who has schools are not there, a child who is not able to go out for any games or any play activity, child who cannot celebrate any birthday or any other participation event. So what he and child, and always we have been saying this, child mind is very fertile mind. If you ask a child to sit at one place, they will not do. We need, so that's a responsibility of a parent or a caregiver, that how we are going to engage a child, and that is very important. If we are able to do it, then possibly you can cut down the screen time. Always we believe actually screen times comes because there is nothing else to do, then the screen time. So the point is that we during this pandemic, I think that's one of the serious issue which has come up, and a lot of discussions we have done, try to educate parent that what needs to be. But the point is that we need to give the alternatives. We need to see that how we can cut it down, and but at the same time, a lot of classes are being there because the schools are closed, but they are through through the medium of either laptop or smartphone. So at one point, child, actually you have to hand over for these activities. But at the same time, you are saying that, oh, you can't play a game or things like that, which again is a very double bind communication, because one point you are giving the thing at the same time. So we need to understand these are some of the difficulty. That is why we all have been saying this, that to have a structure of routine. Even we have recommended that if they are having a class at home, they should be in their own uniform. It looks like a classroom. It looks like they can interact with a friend and so on. And sometimes these parents, they have given the feedback. They are happy about that. That when the child looks forward to it, in that way. So the point is, yes, this is a issue. Which again, I would say it's a secondary issue in the sense that there is nothing else to do. So and there are ways where we can cut it down, and we need to encourage that, and there are methods for that. And just to say that, because sometimes parents become so strict and punitive, no, absolutely no. Which again, we need to understand it's not possible, because for classes we need to do that. So in that way, we need to ensure that. And sometimes we also have recommended that too many such classes in online may also be a problem for a child, because after all, there is a limitation. In fact, some of the recommendation we have given that we can't expect a young child to spend so much time in front of a screen, because sometimes schools are having a number of classes through online. So if at all, then it has to be activity based. In fact, because it's not just a didactic lecture, how they can interact, some activity based, some fun based, some learning. So again, one has to mix up with certain other things, so that it becomes interesting to a child. Because I can tell you, in recent time, a lot of these children have said no, they have become very fatigued with all these online activities. So what they do, they just open their screen and do some other activities. So we have to, it's our responsibility that how we can make it interesting. To make it interesting, we have to engage them. We have to activity based, fun based. We need to give that environment to these children, and hopefully we have something good alternative. Then some of these screen time can also go up. Back to you, Isha.
Thank you, sir. And Alok Jyoti Sahu has an interesting addition to that, that if parents can spend time with children, then screen time can be reduced. I think that, something that Dr. Rajesh Sagar has also been talking about, engagement. The more engaged they are, that's where the screen time is going to be taken care of. Dr. Jackie, if I can take another. So Alok has also asked, can uncertainty be helpful? So we're talking about problems with intolerance of uncertainty. But what is the flip side?
So certainly exposing children from an early age to an element of uncertainty in their environment can be actually really helpful from a developmental point of view. It can help them to develop understanding that there can be different options and different kind of outcomes from certain events. It can build their resilience. It can help them to feel more secure in the environment, and that they have strategies that they can use to manage unpredictability and uncertainty as it develops. So certainly, I think some elements of experiencing uncertainty developmentally are actually really very important, and can actually be great learning opportunities for a young child. So, one of the things that we advocate in the interventions that we do to address intolerance of uncertainty with parents of young children is we encourage parents to identify everyday manageable uncertain situations and support their child to access that situation and to learn strategies to cope with it, so that they become more able to accept that there is unpredictability and uncertainty in the world, and that will give them the tools that are very useful to them as they grow and develop and become more independent.
Thank you very much. Unfortunately, we have come, it's 5:04, so we've already passed time, but as promised, we are going to stick to time. So this brings me to the moment where I must conclude the session. I think we have really what we've been talking about through the session is responding to the COVID-19 pandemic, responding to this very, very unprecedented situation, at least in our lifetimes, is, on a large scale, it's about identifying understanding, and then mitigating risk. So whether it is intolerance of uncertainty, whether it is the need for social emotional engagement that has been completely brought to a standstill with this pandemic, any and all of this, managing it, responding to it really it comes to about, so like Sabahat was talking about, that yes, you need to isolate, you need to distance, but how do you understand how much you need to distance, who you need to distance? How can you take, a very calculated response to, on the one hand, fulfill your social emotional needs, at the other hand, also, keep yourself safe. So it's really about, this balancing act that all our panelists have been talking through the session. I'm very grateful to Dr. Rajesh, Sagar, Dr. Jackie, and Sabahat for joining us this evening with extremely useful insights and strategies, in responding to the COVID-19 pandemic for all of us. Thank you, as usual, for being a very lovely and responsive and engaging audience, for all your questions. It was a pleasure to take them across to the panelists. We will be meeting again in 2 weeks' time. The next session is tentatively planned for the 12th of July, where we will be talking about OCD in the context of the COVID-19 pandemic. And I think one of the audience also had a question about that, so I hope to take that up in the next session. Thank you all very much and have a lovely evening ahead. Bye-bye.